Now that the Christmas holiday is over, health experts are on high alert. COVID-19 cases are on the rise, and some of you may be wondering what to do if you were exposed over the weekend. Dana Smith picks up our team coverage. She went to the health experts to try and get answers.
If you were exposed to COVID-19 over the holiday weekend, whether you need to quarantine all boils down to whether you're vaccinated.
So if you find out you were exposed to a positive person, if you're fully vaccinated, you do not have to quarantine, but you do need to monitor yourself for any symptoms.
Chesapeake Health Department's emergency coordinator, Jerry Tucker, said you should still get tested within 5 to 7 days after exposure, even if you don't have any symptoms. But if you're having trouble finding a test, that's because demand for testing has skyrocketed.
That really began before the Thanksgiving holiday season. We noticed that, and it hasn't really calmed down at all.
It's not just Hampton Roads. Across the country, some places are seeing a shortage of COVID-19 tests.
That is putting a serious strain on our existing resources.
But Tucker said Chesapeake is meeting testing demands.
If you would have asked me this question last week, my answer may have been different. But I think we were able to work through all of our logistical constraints. And at this point, I feel optimistic that we'll be able to meet the demands of the public.
You also need to get tested if you were exposed this holiday weekend and you're unvaccinated or not fully vaccinated. Tucker said unvaccinated people should also immediately quarantine for 14 days after exposure and isolate if you develop any symptoms. Dana Smith, 13 News Now.
The CDC just released new guidelines for people who are unvaccinated or are more than 6 months out from their second mRNA dose or more than 2 months after the J&J vaccine and not yet boosted. They now recommend quarantine for 5 days, followed by strict mask use for another 5 days if you are exposed to COVID-19.